Hello, everyone, and welcome to another episode, an audio podcast under the Busta Cat episode. This is part two in relating to the need to consider renal health in transfusion care and research to inform best practice. And it's a review on part two in regards to following up on what was discussed as part of the overview in the last audio podcast and part one of this particular subject. And so this is under another Storm Robotics production, and I am the Shientist. So today I'm going to give an overview around this in aligned to a literature review. And this work was presented and it has been published. And so I'm going to give an overview in the form of the literature review that's part of this work. So to begin with, the literature review, or the literature review part of this work, the aim of justification for a literature review was over a 38-year duration. Was at the time to understand what further aspects. Number one was to understand what further aspects of care are required for patients with long-term conditions and chronic illnesses. Number two, to highlight what specific practices would help in the development of transfusion care guidelines. And number three, to provide a further understanding of treatment alternatives, taking into consideration renal insufficiency from a leadership management stance, and of course in relating to again transfusion laboratory practices. So apologize for this slide being a little bit busy, but this slide highlights the methodology that took place. An initial PubMed database search was conducted, whereby general key terms from table one, and I'll show table one in the next slide, such as a blood transfusion, anemia intervention, or renal disease were inserted into the search box. And then table one also presents the sort of arrangement of the different terminologies into three distinct categories. Number one, blood and care, or blood and care. Number two, renal health and care, and three, leadership management and care. And thereafter highlights with this then highlights the number of another table after that will highlight the number of articles and abstracts and articles established relating to those three distinct categories. And then in following, three specific PubMed searches were also conducted. So what I mean by specific was that after identifying certain outcomes from particular initial searches, specific PubMed searches, PubMed database searches were also conducted. And the results of those are highlighted in a second table outlined in one of the other slides here in this presentation. And then there was another aspect to this, where the search strategies involved a basic search and an advanced search, and what's known as a refined search. The reason for conducting three types of searches was to actually identify the most specific literature according to the review and the remit around the review, around the review. So that's the search that took place. Search that took place under in relating to PubMed, the PubMed database search engine. Then there's EBSCO host database, which is another database search engine, and a range of databases using EBSCO, EBSCO host engine also was conducted over a 38-year duration, and this was implemented as part of this search. And databases included databases accessed using through EBSCO host included SINAHL plus with full text review, and the database searching went from 19 so over a 38-year duration was 1977 to 2015. Then there was psychology and behavioral sciences as well, and again from 1977 to 2015, and PHSY info or Sci info from 1977 to 2015. Health source, which includes nursing and academic related publications, again from 1977 to 2015, and then in the International Bibliography of the Social Sciences from 1977 to 2015. And an explicit but basic coding process was used to ensure that the terminologies related to categories outlined in Table 3. And again, another slide will highlight what was in Table 3. Searching also included the following options. So in the EBSCO host database search engine, basically specific categories were implemented to ensure specificity in relating to the kind of paper publications that would come out in relating to the remit of this work. So those included smart texting searching, smart texting's option or searching is basically allows a replacing of the and or method, in which differs according to PubMed. It differs in relating to PubMed the search engine. So and or method kind of in EBSCO host search engine allows a kind of an omission to remove the and or method and or options when looking for papers or publications in relating to particular topics. And this includes phrases and sentences, paragraphs, and or even whole pages in particular cases. In addition, options were selected for full text, peer-reviewed journals, periodicals. The population that was encompassed in as part of the remit was the adult population, and also where abstracts along with publications were available alongside the English language being the main language, and the population group obviously being human and any paper or publications related to human studies, and as aside from animal sort of studies and investigations. So this slide here Table 1 outlines the general grouping of the terms through PubMed, the PubMed search engine. So in here, there's a table that relates to terminologies relating to blood. Then there's terminologies or additional terminologies relating to renal, and then there's a few terminologies relating to leadership and management. And what happened then was, as mentioned, an explicit number of papers were actually identified through PubMed. And this table, or table 2 here, highlights through PubMed how that took place. So, for example, using the terminology blood, or under the column in the first column here, we have the terminology blood, and a basic search where there was a combination of hematology or blood terms, again as listed in the previous table, and where again with blood, a combination of other terminologies used in relating to renal, leadership and management. This revealed initially 48 articles between 1977 and 2015. And then under renal, for example, here you can see there was in relating to a basic search through PubMed, the PubMed search engine, a combination of renal terms were inserted, as again outlined in table 1 in the previous slide, and then a combination of those words in relating to blood or hematology and leadership and management, and that revealed 24 articles between 1989 and 2015. Now, the search generally was over a 38 year duration, but the earliest papers or publications that came out as a result from this was actually from 1989. Hence why only at that time was 24 particular articles that related to this particular search. And then in relating to leadership and management, under PubMed search through the PubMed database search, what happened then was there was a combination of terminologies that related to leadership and management, again as outlined in table 1 in the previous slide, and a combination of hematology terminologies and renal, that actually revealed 291 papers between 1977 and 2015, and then this table, table 2, highlights the results in relating to advanced and refined searches under those particular categories, and so a refined search, for example, and I won't read everything from this particular slide, but with refined searching, it allowed some of those particular categories to be added in relating to the overall remit of this work, and then thereafter allowing particular sort of publications that came out from those particular searches. Okay, and so table 3, and I'm going to describe what was done with EBSCO host database grouping of terms or terminologies. There was the words or the terminologies were a little bit different, but still encompassed the same sort of remit in relating to the PubMed databases, the PubMed database. So the terminologies were in relating to this were blood and care, disease, leadership and management. And again, a combination of these words would have been used to identify papers that related to the remit of this work. So further terminologies were used. So for example, with blood and care, further terminologies would be, for example, adults, anemia, transfusion care, and red blood cells. For example, with disease, there'll be adults, chronic illnesses, long-term conditions, and renal disease or kidney disease would have been part of this as well. And then in leadership and management, there would be those again in relating to practice, research, healthcare management, and again in relating to any publications in the adult relating to the adult population. So I'm now going to talk a little bit about the analysis and the synthesis of literature from implementing the searches. So in the analysis of literature, the critical a critical appraisal skill program was used or implemented, and the CASP in 2015 allowed papers to be identified and classified based on the types of study. The CASP is a toolkit really, and researchers, investigators across different sort of health sectors, etc., who are doing research or are involved in research, still can access the CASP, and basically what it allows is where papers based on searches or particular searches where terminologies are implemented as highlighted in the previous slides, basically where the studies are classified or identified according to the types of studies. So for example, whether they were qualitative papers, qualitative publications, quantitative publications, systematic reviews, randomized controlled trial research papers, interventional papers, sort of cohort studies, case controlled, and for example, diagnostic test studies. And so in line with this, around this time when this research was being done, 450 abstracts 450 abstracts went under a 10-question screening process. So the CASP helped analyze in the following manner. So number one was the study or the investigation that had been published in relating to the remit of this work. For example, is the study or was the study valid? Did it hold validity? And number two, what were the results? What were the results of that work? Number three, will the results, or would the results help locally? And the CASP 10 questions. So those are just 3 of the questions, and there's in the CASP there's 10 particular questions. So the CASP 10 questions screening process is generally designed for investigators and researchers to help think about issues systematically. And a number of prompts are given after each question, and these are designed really to remind why the question was important in the first place. So what I mean by that is based on not only the overall remit of the research question, the research work, but the aims and objectives around the work, and any sub-objectives, for example. So again, a number of prompts are given after each question, and these are designed to remind why the question was important in the first place. So the findings around this, or the results around this, were thus. So overall, a total of 141 papers, or abstracts, sorry, through PubMed, or the PubMed search engine or database, and 196 through the EBSCO host databases, were identified. Those were the results initially. After removal, though, of duplicates, any papers that any publications that were across the 2 different databases, duplicates were removed. 274 abstracts were subjected further to inclusion and exclusion criteria. In this work, or in this presentation, apart from the different terminologies we used, and the main inclusion was that paper publications would have to be linked to humans, the human population, or human studies. Apart from that, apart from those being the main, any other publications were automatically excluded. So as highlighted, so in synthesis of the 274 abstracts, 82 papers were then evaluated, which helped to derive themes. Another table in this work, table 4, summarizes the number of papers according to the different themes, and between using PubMed database search engine and EBSCO host database search engine. So before I come on to the highlighting what is in table 5, 4 primary issues were swiftly recognized, and this sort of highlights in relating to those particular themes as well. So there were only 3 papers that explored red blood cell transfusion and considered renal insufficiency before 1978. So that's before 1978, according to theme 1. And then number 2 was the literature managing anemia in the chronically ill and untransfusable patient after 1978 has increased or grown. There have not been formal care plans to safeguard red blood cell transfusion sort of use in different populations for the longer term. So that is in part in one of the findings in relating to theme 2, or swiftly recognized under theme 2. Number 3 was that the alternatives and indications for red blood cell transfusions in patients with long-term conditions and chronic illnesses still are somewhat inconsistent and not transparent universally, and this can make laboratory practices or transfusion practices difficult to standardize. So that's the alternatives and indications for red blood cell transfusion in this context was under theme 3. And then number 4 was that there is limited emphasis on the importance of research in leadership and management to inform best practices and in relating to context around the limited emphasis on the importance of research in leadership and management. That context is under theme as part of theme 4. So table 4 here, table 4 highlights the themes derived from this research and the explicit number of papers according to those particular themes. So themes derived, so theme 1, a lack of renal health in transfusion care strategies for patients with long-term conditions and chronic illnesses, and there were across the databases after particular searches were done. Particular searches were implemented. 20 papers or 20 publications related to theme 1. In theme 2, relating to managing anemia in the chronically ill and transfusible patient, 24 publications related to that. In theme 3, alternatives and indications to red blood cell transfusion, there were 19 publications that related to that theme. And theme 4, the importance of research in leadership and management to inform best practice, there were 19 publications in relating to around theme 4. So I'm now going to talk a little bit around some of the understanding around the different themes, and I apologize in advance because the slide set around all of these, the next few slides or so will look quite a lot. So I'm just going to highlight some of the main things under these particular themes. So theme 1, lack of renal health in transfusion care strategies for patients with patients with chronic illnesses, for example. So the decision to transfuse is influenced or also influenced by numerous factors that are unmeasured in retrospective observational studies. So, for example, or such as the severity of pre-existing comorbidities and the extent of intraoperative bleeding, for example, and hence cannot be accounted for by multivariable statistical testing observational studies comparing transfused with non-transfused patients can overestimate risks of transfusion. Another important issue is that some important risk factors for acute kidney injury, for example, are likely to be interrelated with transfusion, making it a little bit difficult to account for the independent effects by multivariable statistical testing. And again, this all highlights further that there is still a lack of renal health in transfusion care strategies for patients with chronic illnesses, since majority of patients can have preemptive or perioperative complications, and anemia being the most common. And also just to highlight here, along with that context, is that generally speaking, depending on the subject, depending on the condition, certain publications would highlight more around that particular condition rather than the for example, around the renal health or the renal aspect, in around the renal aspect. And this also goes without saying in relating to transfusion care strategies and practices, because publications can talk, or authors can highlight more about other particular conditions that sort of overlap with transfusion care strategies. So again, multivariable statistical testing can overestimate the risks around transfusions in some regard. Also, I want to highlight here that to overcome the difficulties associated with red blood cell transfusions, some practices involve alternative strategies to randomize transfusions, such as donor-specific red blood cell transfusion, human leukocyte and the DR locus matched transfusions, partially or totally HLA matched donor red blood cell transfusions, and the use of a cytotoxic T lymphocyte antigen for immunoglobulin to inhibit alloantibody responses to red blood cell transfusions. And so individualization of anemia management has appeared as a consistent theme throughout several recent guideline and recommendation publications, and this has been important to the use of red blood cell transfusion issuing and practices in laboratories where patients with chronic illnesses and long-term conditions are applicable. So theme 2 then, theme 2 relating to managing anemia in the chronically ill and untransfusable patient. So when this research was done, the National Blood Transfusion Committee, or NBTC, had a major role in overseeing the Better Blood Transfusion Initiative in England, where there was a demonstrable success, including a reduction in the morbidity and mortality associated including a reduction in the morbidity associated with transfusion, documented by the serious hazards of transfusion, or SHOT, as it's abbreviated as, and a reduction of 20% in the use of red cell transfusions. Now, in 2015, at the Institute of Biomedical Sciences Congress, there was concerns by one of the presenters, where they highlighted that generally in relating to the untransfusable patient, there can be issues in relating to patient safety. Number 2, demand for blood and shortages, and 3, the evidence of variation, or why the sort of variation that there was, or and in part still exists evidence of variation in transfusion practices across the United Kingdom. And the presenter at the time also highlighted that there needs to be better consensus to ensure that the better blood transfusion initiatives are made an integral part of the National Health Service transfusion care. Now, how transfusion care is best practice and the indicators and triggers are being more established for the chronically ill and untransfusable recipient will become or have become more important as the prevalence of CKD, chronic kidney disease, has also increased in the general population or at population health level. This also has resulted in renal insufficiency in patients with other long-term conditions, chronic illnesses, potentially warranting more up-to-date guidelines and research on this particular around this particular theme. So being around what is deemed as the untransfusable patient. So theme 3 about alternatives and indications to red blood cell transfusions. So the use of EPO or erythropoietin to increase erythropoiesis offers an alternative to red blood cell transfusion in part, assuming normal responsive progenitor cells and adequate iron, folate, and cobalamin stores within patients are in keeping. So future research should examine whether clinical outcomes for EPO use in chronically ill patients are important and actually in a way cost effective, because because platelets play an instrumental role in primary hemostasis. Platelet transfusions are often important or more important in managing patients who are bleeding or at risk of bleeding with thrombocytopenia or low platelet count or an impaired platelet function. Retrospective research informs a restrictive strategy for red blood cell transfusion is at least as effective as and possibly superior to what's known as a liberal transfusion strategy in some patients, except for patients with acute myocardial infarction and unstable angina. Unfortunately, this one of the studies that came up as part of the publications, or one of the publications that came out as one of the results in this research, there was no unfortunately, the study did not provide or assess for alternative therapy or therapies, and in other work there was and in other work in the same publication, there were no real comparisons made between critically ill and chronically ill, etc., about what might work better in the care of patients in the longer term. So that then leads into theme 4, the final theme here. So theme 4, the importance of leadership and management to inform best practice. So one of the publications that came out during this work was that in an online study which was titled "Important to Consider Cause of Kidney Failure When Planning Future Treatment," it is important to know when treating patients whose kidneys have failed, and health professionals should keep in mind the original cause of the patient's kidney disease and adjust the care plan, the care plan or treatment plan accordingly. Now, when this research was presented previously or retrospectively, the guidance for those who may need transfusing blood transfusions, or at least in relating to hemoglobin and looking at anemia, a 90 to 100 grams per deciliter may be advisable, but definitive guidelines await further clinical trials. In some contexts, some trials have come out in following in relating. However, as with all such treatments, where healthcare treatments are concerned, the decision to transfuse should be based on individual assessment of patient signs, symptoms, and comorbidities. Retrospective research also informs that doing less is actually more, and debate whether there should be more consideration and understanding of having lower red blood cell transfusion thresholds in place before issuing red blood cell transfusion units. In following, the administration of EPO or erythropoietin or EPO erythropoietin-like substances to chronically ill patients is effective in raising hematocrit. Hematocrit concentrations, or hematocrit, is important as a marker of recovery, but also in relating to aspects of physiological infection as well, to some extent. So the administration of EPO or erythropoietin like substances to chronically ill patients is effective in raising hematocrit concentrations, but also in reducing the total number of units of red blood cells for transfusing, and red blood cell transfusions sort of over a particular duration, and when a patient is prescribed red blood cell red cells. A more conservative approach to red blood cell transfusion has been needed, and there is research to inform that that patient blood management, or PBM, is sort of most successful when multidisciplinary teams, or MDTs, and proactive programs are in place, so that these approaches can be more patient-centered. And so, in line with this, there have been informed guidelines for the use of EPO or erythropoietin in patients with chronic kidney disease, and this research had been well informed through the literature from a nephrology perspective. Most published works are appropriate, have been appropriate and applicable, but the conclusions in particular around sort of leadership and management in relating to a link between nephrology practices and transfusion care. Generally, the conclusions are sort of have been historically sort of restricted, because as many will know, generally when individuals work, when health professionals work in one particular discipline, then unless they collaborate with others in other disciplines or specialties, then generally the conclusions and around particular areas of practices are in silo and thus generally limited. And so, as in line with this, this then commensurates with existing awareness. Reliable observations to guide transfusion practices and well-conducted trials to determine what transfusion strategies work best are now more important, or have been more important, to really ensure that the importance of research in leadership and management in regard to transfusion care and practices are really where they need to be, and where transfusion laboratories and scientists, as well as other healthcare professionals, are following best practices. I'm now going to talk a little bit about further research and interventions. So, in a Cochrane review, it had been suggested that loop diuretics such as a sort of well-known loop diuretic is furosemide, is advantageous, can be used, is advantageous in patients receiving red blood cell transfusions. Diuretic pre-medication for patients receiving blood transfusion apparently and has been quite common, especially in those who are at increased risk for fluid overload or pulmonary edema, but this potentially can thus then cause problems around kidney function, renal, and causing or prompting renal insufficiency, putting a strain on kidneys. Research and interventions have certainly advanced in supporting patients with chronic long-term conditions and chronic illnesses, especially with regards to, or with respect to, ready-to-use protocols such as erythropoietin or EPO and alternative forms of red blood cell transfusions. And there is still quite a gap in research, and this mainly focuses on as mentioned, patient blood management, at least in the short term. The question is then what should be done better, and this is a question that can only really be answered by conducting longitudinal studies that look to compare different forms of treatment alternatives, treatment options that exist, and treatment options that can be alternative over time. And future research must also consult renal guidelines, and for example, the Renal Registry and the Renal Association tend to be the first ports of call to gain a knowledge regarding to what formally constitutes chronic kidney disease and renal insufficiency. An overall conclusion, and this is again, this was a work that was presented a little while ago, and a book publication has come out of this, but one of the conclusions or concluding points from that work and this work is thus: the National Blood Transfusion Committee in 2014 informed that transfuse one dose of blood component at a time, for example, 1 unit of red blood cell or platelets in non-bleeding patients, and reassess patient clinically with further blood count to determine if further transfusion is required or needed. And so nationally, centers are now and have now moved toward a single unit transfusion policy, in keeping with, number one, patient blood management, or PBM, and number 2, to reduce inappropriate blood cell transfusion. And generally, this helps management in patients who may have a known renal insufficiency. And in a summary, I'm going to highlight the following as well. So there is a need to explore supplementation and adjunctive agents such as iron, folic acid, and vitamin B12, longitudinally, but also in patients who may have particular chronic illnesses and long-term conditions as part of their care, as part of their care plans. The use of EPO substitutes in untransfusable recipients may provide an alternative to a red blood cell transfusion or blood component or blood products, but in emergency cases, as practitioners, scientists, those who are part of the multidisciplinary team know that in emergency cases, red blood cell transfusions cannot be replaced in terms of volume and replenishment in relating to particular cell components that whole blood is made up of. So other alternatives such as hemoglobin-based oxygen carriers and perfluorocarbons are also being explored, have been explored, but the issue is there is not enough studies to inform validity. And again, this work was work from 2017, and prospectively, or since then, there still haven't been enough studies, investigations, and research to actually see or identify alternatives in relating to their validity. The ultimate goal of transfusion practices, however, is to achieve excellence through evidence-centered practices, but also involves scientists who can demonstrate knowledge integrating practice. And so what this means is it is essential to the future success that informal in relating to mentorship and in relating to areas of practices. It is essential that negative leaders and managers be discouraged, and positive leaders and managers possessing positive qualities be identified and nurtured to lead and or manage the profession. And this is important because in relating to transfusion practices, but also in other areas of laboratory medicine or laboratory practices, what this actually means is that health professionals who are proactive and, for example, assess and interrogate literature to compare and contrast between areas of practices. Those are the sort of scientists and health professionals that are actually required in line with and across healthcare, in line with and across healthcare, so that professionals, whether on the front line or aligned to other areas of practices, then are generally following and using those ways of professionally developing. And so in this case, scientists are also needed who consider renal health more intricately in areas of transfusion care, through research to inform best practice. And that's where I end this sort of second part to this particular audio podcast. Again, there's a list of references here, and I apologize again for the references listed here being a little small, but if anyone wanted to follow this work up, feel free to follow up through the renal patient support group, the RPSG, and generally, this audio podcast, as I mentioned, is available, should be available on YouTube, as well as on Instagram. So thank you for listening, and if there's again any questions, feel free to follow up with the renal patient support group, the RPSG, who which was one of the main collaborators as part of this work when it was initially conducted. Thank you for listening, and feel free to also use the timestamps in the videos audio podcast to take any notes if required. Thanks.